I understand you're here for the carpal tunnel syndrome. You're experiencing right now in the left wrist.
Yes.
So okay, so clue us in. How long have you been having that hand problem?
It's about 6 to 7 months.
Okay.
It started sometime at the beginning of this year. Eventually, I noticed that I couldn't close my palm. It would be this way. I couldn't hold my coffee cup, and it started to get worse and worse. Since that, these two are numb. Sometimes I'm in the shower and the water would hit certain area, especially this one, to die for. And I sometimes, if I'm trying to grab a blanket, hurts and it has this numbing sensation, tingly, and it's been getting worse. And then
all right, so what I want you to do is I want you to put your hands like this, okay? I want to test the muscles. Okay, just do as strong as possible. Okay, see there's some weakness here. Okay, so this one's nice and strong. This one, see there's a little give here. It tells me, okay, so we got some issues with that 7th or 8th cervical nerve root over here. Okay, but also, see, you also got weak here too. So you also have a 5th cervical nerve root issue as well. So we'll take a look in your spine to correlate. So 5 and 7 or 8. We'll take a look what's going on with that one.
okay.
The very first thing I'm looking for in terms of the visualization, all right? Our body has a defense mechanism. So when there's tissue that's damaged, it starts to swell up and also the muscles start to tighten up. So what I'm feeling already right here, you have a huge muscle knot over here, very tight. It's also very swollen on the left side of your neck here. Tracing along. Okay, you have a smaller edema here. Tracing down even further. Okay, we got something down here. We'll check the pelvis. Okay, we got some swelling down here as well. Okay, so we'll keep that in mind. So right now, what this device is doing is looking for potential heat readings, right? Differentials, because when something's tissue is damaged and inflamed, so you have something that's like 1 point to the right over here, so we'll keep an eye on that one.
Okay.
And we'll tracing and take a look for the other ones, other potential areas. And we got a bigger one, 5 points to the right, at this level. So we got that reading to the left a bit. So scanning your neck. So we got that reading to the left over here. So now what I'm doing is I'm overlaying the data I'm seeing in the X-ray to what I'm seeing on you, and I'm comparing some potential problems we're going to rule out. And how's this? Tender right here?
Yes.
Yeah, but this one, not too bad. So you see how we move it? See your left hip? It's not moving. See your right one? I can move it just fine. So the swelling plus the fixation is a good indication this is a potential candidate we need to address. Now we check the biomechanics of everything else in your spine. See, even though you have a little swelling and reading here, see this is moving. Somewhat fixated, but not too bad. So we're gonna leave that one alone.
Okay.
And see, you still got all the swelling right here. Feel that knot right there?
Yeah. Yes.
Yeah. Now we challenge it. How's that right there?
Oh.
Tender right there, huh? Yeah, there's that 5th cervical. It's not moving too well at all. So even though you're originally here for says, oh, I got carpal tunnel. Says, why are we looking at the neck and the spine and all that stuff? Well, everything's all connected. Because if we have a potential problem over here at the neck, see this nerve over here? If there's a problem here, this nerve goes to the shoulder, elbow, and into the hand. So if we find a problem over here, could be the reason why the ligaments and the muscles are not working properly as they should in the wrist. So now let's piece all the information together. So we got carpal tunnel syndrome. We also want to rule out double crush syndrome. That means, okay, it's a condition where there's another problem further up the stream that may amplify and make a carpal tunnel syndrome even worse than it should be. So that's why we want to rule out anything neurological straight up to the neck itself. Now, take a look at the lateral over here. This is sticking out like a sore thumb. Why? Because you have a significant osteophyte sticking out and protruding right over there. It's no different too, like this over here. I want to see it normal, but that level right here is at this point right here, okay? There's a lot of osteophytes, and that osteophyte's also encroaching into the foramen itself, irritating that nerve. So that's why I'm seeing over here, see, I see a stenosis, okay?
Yes.
Sorry, correction. I see a foramen, there's a hole, the tunnel here, but see this is a lot smaller compared to these other two over here. So therefore, okay, that's why this is a very strong candidate. In addition to the examination, we found, says, okay, we got a lot of swelling on that side, huge muscle knot, everything trying to stabilize, because you see everything over here is going this direction, and then up here, tilted that direction, right at that fifth cervical. So this fellow over here, because it's tilted this direction over here, the disc is swollen on that vector right there, irritating and pinching the entire left fifth cervical nerve root over there, okay? I am checking what's going on your 7th and 8th cervical nerve roots, okay? The 7th cervical nerve root is like, it's not too great because you do have some, a swollen disc over there as well, but the 8th one doesn't look too bad. So most likely we'll just have to address this one, just the 5th cervical alone. Now, let's see what's going on the other end. Why we have to address? Because once I see a particular type of degeneration at the 5th cervical, biomechanically speaking, what I'm looking for is, there's just something that says, okay, what caused this to twist all the very top like that, okay? So I want to trace, instead of working on just here, it says, okay, even though I work on this, I can work on this all day long, but that problem's going to eventually come back. How can we minimize it from coming back? Well, you got to trace it all the way straight down. So when I trace that twist all the way straight down, everything's pointing out to that left hip, okay? So when I take a look at your foundation over here, the whole entire foundation is sinking down on the left-hand side. In addition to this line, it's supposed to be in the middle, but it's off to the left. There's also taller over here. So biomechanically speaking, in a three-dimensional plane, your spine did this, that. So you told me, how low can you walk this way? You can't. Your head has to center and level this way. So exactly. So that's why your body started compensating the way it did. It went to the left, the right, left, right. So that's why we have to restabilize your foundation to take a lot of pressure off of that neck. So we're gonna start testing some cool things on you, and you're gonna see what kind of difference it makes to that left hand alone. In terms of what's going on with your hand, okay, I do see several issues going on over here, okay? First things first, the radius is misaligned. This lunate over here is, I wanna see a double rainbow arc, okay? But instead of having a rainbow arc, this bone over here is slightly tilted this direction. Your capitate is also slightly misaligned, slightly misaligned this way as well, because see, there's a gap here.
Yeah.
See, there's this gap here. Yeah. So this whole entire bone is rotated like that direction. So that's why we're gonna realign it that way. In addition to, we also see your first metacarpal bone, it's supposed to be here, is right off of that bone over there. Okay, so that's why, yeah, we gotta rebuild this whole entire thing, because you just don't have enough nerve function going into this hand. That's why all the ligaments that's supposed to keep the bones together, like this, okay, you're supposed to keep it nice and taut. But if you don't have enough nerve function, what happens is it's like it's slack. So when you start using your hand, because you still gotta use the hand, right? Yeah. What happens is the bones eventually gets knocked out of alignment. So that's why it's very important to restore the nerve function. So therefore, instead of having slack like this, now it becomes nice and tight. You got it. Then we can get to work to rebuilding and stabilize this whole entire hand. Okay. Any position you notice that makes that left hand worse right now?
Yes.
Oh, okay. Can you demonstrate to me?
If I does like this, or if, for example, like I told you, if I try to grab the blanket, or if I'm in the shower and the water hits.
No, I mean saying right now. What can you do right now?
Right now I can do it like this, but these are numb.
Okay, so right now it's like you have.
Yes, I can, but before I didn't get the shot.
What about, can you make it really tight or no?
Not that tight.
Not that tight.
Yes.
Okay, so I want you to remember that. Okay.
Yes, not that tight.
Okay, got it.
Yes.
Make this a happy camper.
Ow.
Okay, come on up when you're ready.
Yes.
Okay, coming up when you're ready.
I think I'm fine.
Okay, stand up when you're ready. Okay, now what I want you to do is this. Go ahead. Test that grip strength. Tell me what's different about it.
What did you just do?
Tell me what's different about it.
I can do it a little bit better than before.
How much better would you say?
Like 8?
80% better?
Yeah.
Okay. You know what? Let me test another thing. Sorry, I forgot to test this on you. So I want you to do this. I want you to squeeze this as hard as you can.
Like this.
That's right. Okay, go ahead. Squeeze as hard as you can.
Oh no.
I know it's a little hard. Can't squeeze it too much, huh?
Mm-mm.
Okay, so right now.
But before, when I was making that fist, it would hurt. But now it's like.
So we can see it's like it's almost nothing there. This is just like 20, no, not even, it's just like 10 points. 10 pounds of pressure, we could change it at. Okay, but you're ready, you start to feel a little stronger.
Yes.
Okay, so let's get to the next part. So the exercise I explained before, biomechanically, because you're so twisted, okay, it's putting too much pressure on that fifth cervical, okay? So now we took some of the twist out of the entire spine, took some pressure off of that. Now let's get to work, get rid of that fifth cervical. Just relax, relax.
Ow!
There it is. Sorry, I know that was very deep, but come on up when you're ready.
Wow. Oh my God. I don't know when the last time somebody ever cracked my body.
I know it's a very deep adjustment. Okay, let me go get that over here. Okay, try this now. Holy smokes. Yeah, you actually moved it. Right there.
One more?
Oh, you actually got 20 pounds of strength in there. Try it again. See? It's moving. Okay, relax. Okay, I'll show again. Okay, go ahead, squeeze. See, now we actually got strength in there. How do you like that? Tell me, what's different about it now?
My, the numbness is not there, and it's there, but not like before when I came.
Mm-hmm.
And I don't think I have that much of a pain. It would always be there, and I would go for massage and be like, oh, it stands.
Pretty cool, huh?
It has a little bit, not like I said, like when I came.
Okay, so how much numbness you have left in those fingers?
Before it was 10, I would say, and I would say 5 now.
So 50% improvement in numbness.
Yeah.
Hey, that's great. You see how much motion there is? See this?
Yeah.
Over here, this is stable. Mm-hmm. See how much give there is? So the fifth cervical nerve root is also responsible for this. So I wouldn't be surprised.
So that's why sometimes it would hurt here.
Yeah. So it's not enough strength in there. So we got more work to do. Okay, in future visits, we'll keep on working on that fifth cervical.
Yes.
Okay. Mm-hmm. Now let's go ahead. Let's work on this. Okay. Radius is a little bit better, but let's set this like that. Lunate. Okay, a little more. There's this little piece stuck right there. Capitates out. Right there. We're gonna set this. There we go. A little more.
Oh.
There it is.
Oh my God! Wait. Mm-hmm. I feel the tingle when you did that over here.
Mm-hmm. Yeah, we're getting some more nerve function in there. Okay, hold on. Let's get your thumb in place. Okay, just relax. Relax a little more. We got most of it in there. It's a little vector. There it is. Okay, go ahead. Give it a try. See how you like it.
Oh, but when you did that, I could feel the the tingling in inside here. Oh, wow.
How's the numbness right now in those fingers?
It's still a little bit, but not like when I first came.
Yeah, you said 50% numbness. How's it now?
Just a little bit. Just
How much a little bit? What? 10% left in there? 20, 30, 40?
yeah, probably like 10, 20.
10, 20% left in there. Hey, that's great progress. Okay, let's go ahead. Let's test your muscles. Okay, go ahead. Give it a squeeze. Wow, how do you like that? You can let go now. Yeah, right there. It's like 50 right there. Started from 0, got up to 50 pounds per square inch in there. That's a remarkable difference there. How you loving that, huh?
Wow.
Okay, so we still got more work to do, as I mentioned before.
Yes.
Okay, we got, that's quite a bit of degeneration in the neck in there. Okay,
When I would
roll.
push on this, it would hurt.
And now?
But now. What have you done? I didn't know I didn't come before.
See, it's magic.
Yeah. Oh my God. Thank you.
Oh, you're very
Thank
welcome.
you so much. Okay. Yeah. I was telling her I had to put my hands in socks because it would be so cold and numb.
Well, there you have it. Okay. Well, you're very welcome. We'll see you next time.
Yes. Thank you.